couple of things on the agenda for today, but first off, we have had 66 new cases in the last 24 hours, bringing our total up to 725 here in British Columbia test positive cases. That includes 359 in Vancouver Coastal Health, 241 in the Fraser Health Region, 52 here on Vancouver Island, 62 in Interior Health, and 11 now in the Northern Health Region. As you are aware, we have 9 long-term care facility outbreaks that are ongoing. There's no change in that number today, and all of the stats stay the same with the exception of the 2. One, the Lynn Valley Care Centre, we've had an increase in 4 residents and 3 additional healthcare workers who have tested positive. And in Harrow Park, we have an increase of 2 residents and 1 additional staff member who's tested positive in that outbreak. All of the others continue to be investigated and managed. Of our 725 cases, we now have 66 people in hospital in BC, and of those, 26 are in the intensive care unit, and 186 people are fully recovered. We have no new deaths today, thankfully. A couple of things that have come out in the last day or so. One, of course, is one that you may have heard of. We have new prescriber guidelines to support people who use drugs and people who have issues with substance use disorder or addictions. And this is particularly to support people in places like the downtown east side who may be affected by COVID-19. And so these guidelines are to enable us to provide a safe supply for people and to ensure that they're able to comply with our public health advice around isolation or quarantine should that be required. So I think that's a very important piece to help ensure that we can support people in those situations as best we can. In addition, I mentioned in yesterday's briefing, I've made 2 additional orders under the Public Health Act in BC. One is enables health sector workers at all public and private facilities to remain at one facility only for the duration of the pandemic. This includes long-term care, assisted living, extended and acute care. So this is one of the key things that we've talked about as being a risk, particularly for our more vulnerable elders and seniors who are in care homes or in assisted living, where we've had a patchwork system of care providers, healthcare workers of various different kinds who move between facilities. And that is one of the things that has facilitated movement and outbreaks in a number of different facilities, unfortunately, so far in British Columbia. So this will be really important to help support those workers to be able to work and to maintain the support that we need in those facilities with decreasing that risk. So decreasing the potential for transmission both between healthcare workers, but also, most importantly, between facilities. The other thing that was announced earlier this morning, which you would have heard, is that Minister Farnworth has come out with a number of enhanced provisions and made it quite clear around the provincial emergency declaration under the Emergency Programs Act. And I'm really pleased that he has done some things that have defined essential work for the province, and this will help clarify things, as I know a number of different municipalities were looking at different definitions of who essential workers were and what types of essential services we needed. As well, there are enhanced powers to enforce the orders that we have in place in British Columbia, whether they're orders for isolation, quarantine for people who have returning travelers. And along with that, the Government of Canada has now determined that they are going to use the Quarantine Act to enforce a 14-day quarantine for all travelers entering Canada. So that became effective as of last night, and we are and will be working with them to ensure that we can align our enforcement of these orders if needed. And I think it's, we've said before, although it was an expectation at the federal level, it has been an order for people here in British Columbia, and we have had good compliance with this order, although in a couple of occasions we've need to enforce it. So every day that we stay home, that we do what we have been asked to do, we stay apart but staying connected, brings us a day closer to being able to manage this response. There are still many, many things that we can do and we should be doing together. We can connect with friends online, we can share stories about our day, we can share pictures, we can share videos, we can have celebrations together virtually, and there's lots of those that have been examples lately of people having birthdays where their community can celebrate without having the physical connectedness that puts people at risk. We can all make a difference, but we need everyone to be 100% committed to doing this. That doesn't mean 100% of people all have to stay in their house, but each and every one of us needs to right now make that commitment to stay away from people who are vulnerable, to stay at home when we can, to go out for essential things only, to make sure that we are able to provide those essential services. If you're a healthcare worker, if you work in a grocery store, we're depending on you, but we need you to do that safely, and that means maintaining the physical distance between people. But we also need to continue to coming together as a community and to do that virtually. So we need to take care of each other right now. We need to be kind, and we need everybody to do their part.